Good, it's rolling.
Okay.
60 minutes. I swear she was, I was just trying to help that goat over the fence.
I swear it's true. So, when did you decide to leave traditional medicine?
I started practice in '82. In 1990, I started getting the sense that it wasn't working for me anymore.
What made you think that?
Well, you know, as you know, we were trained in an era of medicine where the technology and the economic system involved, the insurance thing was not so intense, and it was gradually over the period of the 1980s that the HMOs and just the aggressiveness of the insurance companies started becoming more and more apparent in terms of if I wanted to send a patient to see you to have their gallbladder taken out, and I knew that you were the right physician, you had the right personality for this particular patient, I had the freedom to do that. But the insurance company said, no, you don't. You send it to somebody in our system, or we will approve only this person. It just kept becoming more and more restrictive to the practice of a more humane and personalized style of medicine. And so after several years, I just said, I can't do this anymore. I was having conversations on the telephone with insurance adjusters who were directing care, and I remember one day I slammed the phone down after a particularly difficult half hour trying to convince somebody as to what I wanted with this one patient, and I said, I can't do this anymore. I felt like I was, as a family doctor, like I was a gatekeeper. I was not a physician anymore. I was a gatekeeper or a provider of services. The deep spirit of medicine was not possible in the new system for me.
So why'd you pick what you picked?
I wanted to do something where I could use my talents, where I could use my medical background, where I could use my ability to relate to people, my curiosity as to what was really behind things like chronic pain. You know, chronic pain patients were the most difficult patients for me as a family doctor. What was on the menu of options, drugs, procedures, was just not working so well. I would get frustrated with people who kept coming back with persistent pain, and I was just being a palliative, providing palliative care. And so I was really curious as to what was going on behind chronic pain, behind illness in general. And so when I put down the prescription pad completely and did not order tests, I would only see people after they'd been fully worked up medically, and then I would sit with people for hour after hour and learning how to explore the roots of suffering. Acupuncture is a wonderful humanistic style of medicine that relies on a very intimate exploration of a person's totality, their history, their presentation, their context. And what I found is that a lot of medical illness, hypertension, heart disease, immune system problems, pain, autoimmune disorders, have everything to do with a person's life story. For instance, we know now that children who suffer adverse childhood experiences, sexual abuse, violence in the family, somebody in prison, somebody with psychiatric illness in the family, that they subsequently develop a higher incidence of heart disease and cancers and liver disease and lung disease as a direct result of the disruption of something inside them that makes health possible for them. It's not just smoking behaviors and dietary choices that they make. It's something that happens to a deep, homeostatic, autonomic nervous system disruption. And so what I found is that acupuncture gave me the ability to contact that part of a person, and many symptoms melt away with careful connection with the person, with something in these needles, whatever that is. But I wanted to make use of my curiosity, my innate affection for people, my ability to make contact with people in difficult situations.
Is it the needles or is it you?
Yes. The doctor is medicine. We were raised, you and I raised, we were taught in a healthcare system that still had a great appreciation for that, the role of the physician as medicine themselves. Sadly, that is, we cannot claim to call healthcare real caring anymore, because it was the caring of the physician, which is not a professional caring only. I care because I have these talents and I provide care with all the, the armamentarium of modern technological medicine, but care that is responsive and human. That, you know this from your practice. You provide, top of the line technological and scientific based medicine, but it is your capacity as a physician to give a caring interaction with a patient that they experience as care, made through eye contact and gesture and reaching out and touching somebody. That's the kind of care that is sadly lacking, and not only do patients suffer from not having that, but the doctor suffers from not giving that, because there's
How so?
Because care is bidirectional, true caring. There's a wonderful book on caring by a woman named Nell Nodding. She's an educator. She describes a caring relationship. She defines a caring relationship as one element of it as involving a bidirectionality of care, that in some way there has to be something coming back from the one receiving care that cares for the caregiver. And it can be as simple as a thank you. It can be as basic as being compliant with a healthcare intervention. It can be just eye contact and kindness towards a physician who's having a busy day, and the patient can reach out and show a very simple human gesture of touch or a smile. And for a physician to be too busy or too stuck in a technological gatekeeper system of, I have to hurry through this and get on to the next patient, the physician suffers. Burnout is huge in medicine right now, in medical school in particular. 1 out of 3 medical students suffer burnout during their medical education, and that's just the education part of it. And so when you get into a high volume practice, you have a huge amount of debt, you're doing the malpractice insurance thing, you forget, you lose contact with the soul of medicine. And that's a very sad thing. I can't tell you how many patients who come to see me, they tend to fall through the cracks to come into an acupuncture practice. People with chronic pain or symptoms. The orthopedic surgeon who never touches his patient until the day of the surgery. The ophthalmologist who doesn't look at his patient until after he's taken the history. No eye contact with a patient.
The eye doctor without eye contact.
Without eye contact. And I hear these stories over and over again from patients who are bewildered. This is a very rural area here, and they're bewildered by the lack of care. They don't feel cared for. And so not only do the patients suffer from that, but then the doctors become alienated and afraid of their patients and go through the motions of care.
Talk to me a little bit about putting hands on people. Other than you and me putting hands on each other.
Well, yeah, that's
a separate subject.
The power of touch. It's perhaps the oldest form of healthcare. It goes back to the very beginnings of the caring gestures. Animals, dogs, monkeys. There's something that happens in touch, a certain type of touch, that relates to the deep homeostatic mechanisms, the deep autonomic nervous system, the adrenals, the hypothalamus, the pituitary. A set of physiologic and metabolic events happen in the body. It's called the sociophysiology of care, where the physiology changes to something that allows healing to happen, that allows the body's own capacity to repair injury, to modulate its immune system activity, to down-modulate a physiology that, that's from purely a physiologic standpoint, but from a psychologic and even a spiritual point of view, it bridges the experience of a person who is lonely, frightened, in despair, terrified, injured, wounded, marginalized, powerless, out of control. It is medicine. I'll tell you a very brief story. We were in Buenos Aires in an intensive care unit, clowning, international humanitarian volunteer bedside hospital clowning that we do in Gesundheit Institute. And what we call clowning is not face painting, but it's creating an atmosphere of play and joy in the midst of whatever a person's dealing with. And so it was a surgical intensive care unit, a schizophrenic, I'd say 40-year-old woman, ruptured. She had a peptic ulcer that erupted, and she had an NG tube, had the surgery, but she was in the intensive care unit because of her blood pressure. It was very high. She was on the medications for her schizophrenia, so she had a flat affect. You couldn't see any change in this woman. So at 30 minutes of just gentle touch, she couldn't understand what I was saying. She spoke Spanish, I spoke English. On the way, she never gave any feedback, smiling, whatever. It was very gentle, quiet, but mostly touch, looking into her eyes. I was leaving the intensive care unit, and the nurse said, "You want to see this blood pressure tracing?" And her blood pressure had gone from 210 over 140 to 170 over 105, 106 in 30 minutes of just gentle touch. And this is happening all the time in life when we make contact, and empathic, gentle, sincere touch. And that's the thing, it has to be sincere. People know when it's sincere and when it's not. The patronizing pat on the shoulder, "Okay, you're going to be okay, get the heck out of here," doesn't work. It has to connect with a person's sense of their humanity.
You and I are now old.
Yeah.
And we were different people than the kids that are coming up now. Are there people to take our place?
Fewer and fewer in the medical field. I speak all over the United States to medical schools. I will often see, when I talk about these ideas, the nodding of the heads of the gray hairs in the audience. The medical students are curious. They're not quite sure what I'm talking about. Their medical education since 1978, when we finished, has gotten even more technologically oriented.
It's only technologically oriented.
And so the needs of the machine have become dominant, the technology. What is not primary now is the essential human relationship in healthcare. that requires care to be called care. And so, yeah, it's the gray hairs, and they're fewer and far between now, the ones who nod their heads and understand that a well-taken history will give a diagnosis more reliably than a CAT scan or an MRI or an exhaustive workup with procedures. And so the pendulum has swung way over to, and there are many reasons for that, economic and political, and we can't argue with the fact that for many things an intense technological focus is fabulous. If I'm in a car accident or with a true medical or surgical emergency, I want high-tech medicine. But the vast majority of healthcare does not require those types of interventions. What is required is understanding and intelligence and thoughtfulness and kindness. And people don't feel kind. People feel resentful of being in a system that treats them like a barcode. You know, I have Parkinson's disease now, so I've had my own experience as a patient in my local hospital here in this area. And it's heartbreaking to me to feel what I know that others are experiencing in a healthcare system, that the first thing they do is they put the little bracelet on with the barcode and a sheet of paper with all these stick-em barcodes, and I hear like for my colonoscopy, the nurse going through her little speech that she has done hundreds, if not thousands of times before, that has no soul, no connectivity to it. I'm just another person, and I can feel that. And so I try to reach out through my humor and through my clowning part to bridge that human gap, and that works, but most people don't have access to that. They're frightened and they're lost. There's no human connection that trumps the technology.
So talk a little bit about the clowning. What is it? Why that as opposed to something else?
Patch Adams, who you and I know from a long time ago, developed an idea that public happiness and joy and playfulness would work to the benefit of the public and also the giver, the clown themselves. And what we call clowning is spontaneous improvisational play. It's just being playful. You wear a costume to announce to the world that this is not a normal moment, a normal place or time, that this is not business as usual. People at first are a little bit, ooh, what's this? But then to engage in play, we bring music, we bring puppets, we just mostly bring ourselves and enter into the space, be it a corner of a city street, a hospital bed, a school, a prison, a hospice, and we are present with people, and we've clowned with people in comas, we've clowned in people who are dying, we've clowned in obstetric suites where people are being born. We have found that sensitive, playful, sincere clowning works to the benefit of the whole system. Doctor, patient, family. We are invited back virtually every time. And we've clowned in almost 50 countries, in hospitals that are the richest hospitals we've seen, and hospitals with no bedding, no medicine, no food. And everywhere it's the same. It's thank you for coming. Come back again. People who rise from their beds. There's a Lazarus effect with clowning, that people rise from their beds and some desperately poor and intense situations, war zones and refugee camps. And we've been doing this now, I've been doing this for almost 20 years. I'm now director of Gesundheit Global Outreach, and we do projects around the world, going to, again, the worst places we can find, and hospitals and burn victims and trauma victims. And it amazes me every time the transformative effect of play. And when you look at the history of play, the anthropology of play, or the social history of play, animals play. There's this great film done up in the Canadian Arctic of a polar bear coming out of the wild to a group of dogs and engages in play with a group of dogs that are chained up. They're playing with each other. The polar bear initiates play with a group of dogs. And all of a sudden there's not a dominance behavior. It's a horizontality of experience, and that's what we found is when the clown is no respecter of authority. So the clown treats the doctor, that's the surgeon, the CEO of the hospital, with the same regard that the clown would treat a trauma victim or a child. And when you level the playing field in a human society, in a human group, there's a sense of relaxation.
So come into my world now, and how do you balance the technology with the touch?
Well, I would say you do that. You do that already. I've seen you. I've seen how you give people eye contact. I see how you talk to them like they're members of your own family. How you care for them as if they are members of your own family. I've seen how people respond to you. You set that example. It's not something that you do unconsciously. I know you're consciously making an effort because it means something to you. It's important for you that you do that. You're acting not only on behalf of the needs of your patient, but your own needs for acceptance and contact. Because what you do, even though it's so weighted towards the technological side of medicine, for you to be sustained, you need, I know this about you as a person, you need to be cared for yourself in that way. And people care for you in that setting through their honoring your skill, but through their gratitude for what you do and how deeply they express that, through their tears. Especially when things don't go well. It's easy when things go well. It's when things are not going well that really we're put to the test in this way. And showing up and being present and being honest and not patronizing people, but treating them again like you would a friend. So, if I were to step into your situation as a clown, I would, you don't want to clown when, you have a pneumothorax and you have to be acting on these things, or people are bleeding out. You don't need a clown in the way. But the clown is good for the staff after that happens. The staff can benefit by a clown coming in and changing the atmosphere, releasing the clown always constellates the elephant in the room. So if there's excessive seriousness, if there is excessive arrogance, the clown will identify that. And people need to not be, people need a break from the seriousness. People need a break from this sense of self-importance. That's the thing that in our medical school class, we were antidotes for each other in terms of taking ourselves too seriously. It helped us get through an incredibly challenging and sometimes difficult experience, and it's the same in your hospital.
And what do you say to the medical students or the residents now?
I have the opportunity to say this. Humanize yourself. Stay in contact with your human roots. Play music, do art, work out, dance, have friends, cultivate your friendships. It's your friends that are going to keep you healthier. It's being loved that keeps you healthy. The experience of being loved is, and we know this, Dean Ornish's book on loving is an incredible book describing the many consequences of the many negative health consequences of the sense of not being loved. So it is to reach out to each other and love one another and love yourself and be good to yourself. That is what is the single most important thing that I leave with medical students. Because our lives in that medical training are so imbalanced towards this left brain learning all this incredible body of knowledge. We live in our heads, and we're constantly needing to perform and reach a certain objective standard of excellence. And that's great, but if it's not balanced by self-care and art and play and love, we become one-sided, and that has huge negative consequences for us. That's the recipe for burnout.
Has that changed since you and I were in school?
I think it's gotten more intense because the cost of medical education has gone up so much. The technology has become a monster. The machine needs to be fed relentlessly, and so we're constantly having to meet the needs of the machine, the medical industrial complex. We're not called physicians anymore. We're called gatekeepers or providers. That's a tragedy. So it's gotten more difficult. I think the challenges are much greater.
How do you see this playing out with, the kids are so different, I think, than when you and I were dumb, and they communicate differently, they act differently. What's important to them is different than when you and I were coming up in the education system. How does that play here?
I think that has a lot to do with the medical admissions process. What type of people they're admitting? Are they admitting humanists, people with a humanistic tendency, or are they looking for high performance, high performers? I'll be honest with you. In the medical schools where I speak, and Patch would tell you the same thing, there are huge numbers of medical students who want something different, who desperately want to not get swept up in the business as usual business of medicine, who want to be friendly with their patients, who want to have lives that are more whole and integrated and humane. And this gives me hope. The sad part about it is the economic pressure is so great on these people that they have very few choices but to enter into a system of business and medicine that will help them pay back their loans. And so they get caught. It's like a tar baby. They get caught in a system that they can't get out of. It happened to many of our classmates. I'm thinking of some in particular who underwent a drastic change in their personalities. And so that's the risk. I feel for young people. And I think that's why a lot of doctors today are not recommending medical school as careers for their children and their friends, which is sad because I think there's nothing better than being a doctor. There's nowhere else can you approach the problem of human suffering more directly and openly and honestly and congruently. It's the best thing in the world to do. And I tell this to people who want to go to medical school. It's the best thing, best decision I ever made. But you have to not fall prey to the gods of power and greed and fear. You have to keep your spirit high and elevated in order to do really good health care. You have to love what you're doing.
What's for you now? You gonna keep doing this forever, or what are you gonna do?
A lot depends on what happens with this Parkinson's. Right now I can still, it's, my tremor does not limit my acupuncture skills. I'm a new father coming up in November. I have a little baby boy coming. A lot of my life force will be given to this child. I'll still be directing global outreach. I won't be doing as much traveling. I'm going to write a book to try to just talk about the wonderful things that I've learned from people around the world. I mean, I know I must have hugged 10,000 people in hospitals. And I've visited more hospitals than most people ever will have a chance to visit all around the world. Hundreds and hundreds of hospitals. And I have stories to tell. I'll also grow through my Parkinson's. There's a doorway there through which I will leave myself and enter myself and but live into an experience that will give me something should I choose to go after that. I'll be a patient. I'll deepen my sense of what it is to be cared for. Hopefully I'll have friends like you who will keep me human, help me not take myself so seriously.
Last question.
Yeah.
What's humanism mean to you?
A poem by Rilke, Rainer Maria Rilke from Austria. May what I do flow from me like a river, the way it is with children. No forcing, no holding back. Then in these deepening tides, moving out and returning, I will sing as no one ever has, streaming through widening channels to the open sea. What that says to me is life is an opportunity to unfold parts of myself that are hidden, that are waiting to be expressed. That if I follow my heart, the heart that, my heart in equal balance with my head, my passion, my love of life, my love of people, something wonderful can happen in that. I want to take the whole world into my arms. That's what being a humanist is, taking the whole world into my arms, loving the experience of being a human being, and all the full consequence of being a human being. It means beauty, terror, love, fear. It means living into the fullness of my life. You're part of that fullness. You and I have shared love and difficulties. And here we are. And how beautiful.
Got it.